Singapore has joined the ranks of Okinawa and Sardinia as a blue zone, regions in the world where people live longer and healthier beyond the age of 80 due to their way of life. But while Japan and Italy's blue zones are a product of traditional diet and lifestyle, Dan Buettner, the man behind the concept, says Singapore's status as Blue Zone 2.0 is a result of policy rather than culture.
I named Singapore a Blue Zone 2.0. It's a different category, but it's the first in a new category of manufactured blue zones. It's a new order of longevity and health, and the rest of the world should be paying attention.
While the Blue Zone 2.0 status is a result of policy, the government is also aiming to inculcate a healthy living culture, something particularly important given Singapore's aging population and rising healthcare costs. To borrow the old adage, prevention is better than cure.
We are Ministry of Health. We are not Ministry of Hospital. All over the world, we are all focusing so much resources and energy on hospitals, on acute care. But really, Ministry of Health ought to be about building health for the population. Therefore, Healthier SG, Age Well SG, these are important long-term measures for us to rebuild health.
Aside from exercise, social connections play a big role in leading a longer, healthier life, especially for the elderly who can become isolated and lonely. To this extent, active aging centers near homes provide a space to interact and take part in activities like Zumba workouts.
我们80多岁了哈，能够出来就很好了啦，因为健康就是财富嘛，对不对？如果我们退休了，没有自己的活动，没有健康的身体，你就算很多钱，你也是要在家里待着嘛。就是我们时常几个人，有时就玩那个 rugby， 有时他们有那些 game 啊，还有教我们玩那些老人的资历的
To further encourage Singaporeans to take charge of their health, the government launched the Healthier SG program in July 2023, where residents can register and choose their preferred clinic for a free consultation. The aim is for residents to come up with a health plan together with their family doctor, who can recommend activities in the community through the Healthy 365 app.
Through the consultations with our Healthier SG patients, we build a good rapport with them so they feel more ready to speak to us about their problems, and we can also use these consultations to encourage them to have a healthier lifestyle and also more for prevention, for example, having their vaccinations, having their regular health screens.
Active SG was launched in 2014 to get Singaporeans to participate in sports and use the facilities such as gyms and swimming pools. To date, the national movement has a 2.5 million membership base. Building on the popularity, the Active Health Program was launched in 2017 to get Singaporeans to take ownership of their health through screenings at one of 9 Active Health labs. The biometric screening gives you data on your body composition and is followed with advice on your health and fitness from the coaches at hand.
Percent body fat wise, slightly on the higher side, but I think it's still okay as long as you put on the muscle mass, it should drop proportionately.
When I saw the result, it said that I had quite a lot of body fat. So I didn't expect that because my BMI was around 21, 22.
The Active Health Program also offers subsidized strength training workshops for those aged 40 and above to combat muscle loss, which kicks in after we turn 30. Instructors would guide participants using simple equipment so that they can continue the exercises at home.
Before this, I really didn't have the time. No time and no self-discipline. So with the Active Health program and the Stronger at 40 program, they kind of gave me a roadmap. So I found that very helpful. I really like the fact that it's all guided. where your weaknesses are in your body and what you should do to strengthen it.
So when we talk about Healthspan, it's really about being independent as we age, being active and having a good quality of life. And I think a big part of it comes from strength training. And not just only strength training, but I think it's important to be doing exercises that are functional, which means they kind of mimic what you do on a daily basis, right? And some good examples could be your lunges, your squats, or even your deadlifts.
But as the saying goes, you can't outrun a bad diet. On this front, the government is waging two wars, one on diabetes and the other on salt. On the front line, guiding the public in its supermarket purchases are the Nutri-Grade and Healthier Choice labels. But with 1 in 3 Singaporeans eating out more than 7 times a week, perhaps it's time to take a hard look at the food choices available in our hawker centres and coffee shops.
Any change is challenging. Food and dietary habits are even more challenging, particularly in a place like Singapore where all of us are unabashed foodies. That said, we do have to recognize that things have changed. We do need to evolve the foods, and some of the simple things that we can do would be to recognize that some of our heritage foods are not the healthiest for us. It's not that we forego them, but in the same way that the French would not eat foie gras every single day, we also need to make sure that the least healthy of our traditional foods are really a treat for us to be indulged in every now and then. And some of the foods that we may eat every day or a couple of times a week or a month, for example, dish rojak, we can ask for less sauce, we can ask for more peanuts, more vegetables, and that can improve the overall health content of these foods.
According to Dan Buettner, what truly defines a blue zone comes back to the environment. How our cities and estates are built so that we move more and interact with others almost by default. In Singapore, we are building wider footpaths and covered walkways to clock in those steps from home to public transport. Park connectors and fitness corners near our homes to work up a sweat. Community spaces within our estates for activities and for residents to socialize. There are many factors to consider when thinking about increasing the health span of a nation, especially as lifestyles change. With these programs and initiatives, the government aims to lower the barrier so that our journey towards a longer, healthier life isn't such an uphill one.